These are truly rare events. Importantly, similar events have not been associated with the more than 180 million doses of the Pfizer and Moderna vaccines.
That's Ohio's chief medical officer talking about the decision to stop giving the Johnson & Johnson vaccine across the country and across the state. Good evening. I'm Stan Boney.
And I'm Alexis Walters. The Centers for Disease Control and the Food and Drug Administration made that announcement about J&J today.
There have been 6 reported cases in the United States of a rare and severe type of blood clot. They are happening among women 18 to 48, and one of them has died. The symptoms appeared 16 to 13 days after getting the J&J vaccine. So for now, all J&J vaccines have been halted in Ohio and Pennsylvania. Governor Mike DeWine this afternoon held a briefing about that decision.
I listened in on those vaccine clinics, and I listened in on what those vaccine clinics will do from here and what you should do if you have or were planning to receive the J&J vaccine. Recognize, report, and manage adverse vaccine events. That's what Governor DeWine said the purpose of the pause in the J&J vaccine is, and he added the pause will be short.
They describe it on the White House call this morning as days to weeks rather than weeks to months.
The governor and top health officials stressed a few points in today's briefing. One being how few severe reactions they've seen to the vaccine. 6 in over 6 million.
These are truly rare events. Importantly, similar events have not been associated with the more than 180 million doses of the Pfizer and Moderna vaccines administered in the United States.
They're not exactly sure what caused the reaction in those 6 women. That's what's being studied during this pause of vaccine clinics.
And the fact that the CDC and the FDA have raised concerns and pushed the pause button on the basis of these 6 cases should give Ohioans great confidence in not only the priority that is being placed on vaccine safety, but also the reliability and transparency of the CDC's and FDA's safety monitoring systems.
But what if you've already received a J&J vaccine in the last 2 weeks? Doctors say if that's the case, monitor yourself for very severe symptoms.
Look for a few signs and symptoms. Those signs and symptoms would be a headache, change in their vision, shortness of breath, if they have swelling or any pain in their lower extremities, and if they're having consistent nausea and vomiting that doesn't seem to go away.
What those doctors in the state do not want people to do is stop or hesitate getting a vaccine because of this pause. So if you had a J&J vaccine scheduled, you should instead see if you can reschedule with a provider offering Moderna or Pfizer.
If we want to end the threat and inconvenience of COVID, we know that vaccinations are our way out, and we should have absolute confidence in that.
Now, here are the clinics that have been canceled in the Valley because they were slated to give J&J. Tomorrow and April 22nd at the Covelli Center and the Dillard site for Friday and Saturday. For those running the clinics, the government's warning was a surprise.
Again, you're a little taken back because you're like, now what? You know what I mean? You have all these wonderful laid out plans and how we're getting our people vaccinated, and now it kind of throws a wrench into your plans.
Now, there are other options to get appointments to receive a shot of either Moderna or Pfizer. The Warren City Health District is holding a walk-in clinic tomorrow from 9 to 1. Packard Music Hall also tomorrow. Then East Liverpool City Hospital on Friday. You can also still call Mercy Health, Trumbull Regional, and the Columbiana County Health District to make appointments as well.